When I talk to people about genetic testing, the first thing they'll say is, I don't want to know if I'm getting Alzheimer's, right? And that's a very common belief. I understand the anxiety of knowing alone will cause it, right? And so there's a gene called ApoE, and this is a perfect example to paint the picture between what we thought genetics was and what is now possible functional genomics thinking. So genetics is you have the 3-4 variant of the ApoE gene. Now you have an 8 to 10 times elevated risk of dementia, right? Because when you study people in a disease state, the propensity is, that gene is going to be there. And so in some way drives propensity to this disease. But we still didn't ask why. You weren't born with Alzheimer's. You didn't have it at 20 years old, 25, 30. Why does it happen later in life? Something changed, right? So what does that gene do? Now we have to investigate the biology, the piece that was missing. Not the gene, but also the biology. ApoE instructs the transport of lipids, how you move cholesterol around in your body. And if you have inflammation in your brain, your body is going to deploy cholesterol as a highly beneficial hormone to go fix the inflammation. And once the cholesterol gets to your brain, it meets the toxin that caused the inflammation to begin with and also gets oxidized and damaged. So the cholesterol molecule doesn't look like a cholesterol molecule anymore because it's damaged. Your ApoE genetic pathway, if it's not functioning so well, the 3, 4, 8 to 10 times rich, it's even more so doesn't do a good job. So it doesn't recognize the cholesterol, leaves it there, starts to build up, forms a plaque in your brain that we call amyloid plaque, and it eventually starts to choke at the brain cells, kill them, and cause cognitive decline that you give a name dementia or Alzheimer's. Versus if you had the 3-3 version, which you do a much better job of transporting the lipids, the exact same leaky gut or toxic hormone or pollution or, over exercising and causing oxidative stress that caused the brain inflammation in one person, maybe also caused it in this person, but they responded better with the lipid transport and didn't build the plaque. Or maybe they had better detox pathways and the exact same chemical that one person was breathing that led to the crazy brain inflammation, this person could tolerate those chemicals and process them and excrete them. So they never got the inflammation to begin with. So the path is the same. Brain gets inflamed, cholesterol gets deployed, sometimes plaque gets developed. The variables, what caused the inflammation? You can tolerate it, I can't. Why the plaque? Because you developed the plaque, I don't. Eventually disease. So that's where you play the game of what isn't working and what do I need to remove and what do I need to add, and then Alzheimer's is entirely preventable.